All right, into part 2. So how has the stroke really affected my body? So a lot of the times we're looking at, different things of, I really can't do the things that I used to do. And why is that? And what problems did my stroke really cause? The main thing to remember is, even if you're in a group with a whole bunch of people who've had strokes as well, is that each stroke affects every person differently, and that there are some common problems that you may or may not have, but to remember once again that everybody is slightly different and it causes some slight impairments different with each person. Some of the biggest problems that you're going to have is muscle movement problems. So most commonly you may have issues with one side of your body, your arms or your legs, that are not working as well as what they used to be able to do. And a lot of the times, you'll have just sort of your entire left side of the body is not working. And that's primarily because you had a problem or an injury or a stroke in the right side of your brain, just because the body crisscrosses over that way. So the problems with the muscles, it may not get enough of a muscle activation to be able for you to do the job. Or you do have a muscle activation, but you don't know how to control the movement, your coordination is slightly off. And sometimes even you just have a lot of stiffness or a lot of muscle tone, but that tone is not really under your control. The other issue that we have is sometimes language problems. And this is really most commonly associated with people or patients who've had a stroke on their left side, the left hemisphere. And that's purely because the left side or the left hemisphere is really, on the temporal lobe, is your language center on that side. On your right side, it's more of structure, more art, more creativity, bigger issues, but your language, once again, is more on the left side. And in those language problems that you would have, it's primarily word finding issues. You're able to sort of understand what is being said, but you don't know how to respond or give it an appropriate answer. The other thing that you're able to do is you're having difficulty in being able to actually express yourself. So that's just on the language side. Also associated with that is some swallowing problems. And the swallowing problems that you're really having is, once again, going back to some of the muscle problems. Swallowing is largely a result of just having coordinated muscle movements of your throat to be able to get whatever's in your mouth all the way down into your stomach. Given these difficulties, you're also at a high risk for aspiration or having the food or liquids or even just saliva going down the wrong tube. And instead of going down into your stomach, you're now getting it down into your trachea and eventually into your lungs. When that happens, it puts you at a huge risk for eventually developing pneumonia or some sort of pulmonary infection. Obviously, we want to avoid that. Some other issues that you may have is some vision changes. Some strokes, depending on where they are in the location of the stroke, can actually limit you from having one entire side of each eye not being able to see. So we call this a homogeneous hemianopsia, which basically, if I were to bisect both eyes, if I had a left homogeneous hemianopsia, I would mean that I could not see the left of each eye. So basically, the side on my right eye closest to my nose, I would not be able to see. And then on my left eye, closest out to my ear, I would not be able to see that either. So I'm only seeing half of what's in my world. We're also commonly able to have patients who've only got very small sections where they have a field cut. So it's only a small section where they're not able to see. And once again, too, that's also going back to where in the artery, or which artery was involved in the stroke and location-wise in the hemisphere. Another common thing that you're also able to see too is some patients actually have double vision. So they're not able to focus their vision to get one clear focused view. Their viewpoint is slightly off as a result of coordination problems or impairments, and you're then starting to get different images that are just slightly off. So you end up seeing double of whatever you're looking at. Another problem that you're commonly seeing is problems with your thinking. So you most likely are having issues with attention or your memory. The other issue that you're having is you have a really big problem with your speed of thinking. So it takes you a really long time to not only pick up what's been said, but then sort of process and take yourself through the steps of what would need to happen in order for you to make the conclusion for whatever the problem is. And then another issue that we often commonly have is issues with problem solving or reasoning. So if you're handed a task and you're trying, you're asking somebody, well, how would you get from point A to point B? Or how would you do this task? Sometimes it's really difficult for you to actually be able to put one step in front of the other and to see where your starting point is and safely get to your end point without having big chunks missing in your problem solving. Another very common issue that we also face is bowel and bladder incontinence. And when we look at this too really is going back to, both your bowel and your bladder are controlled by muscles. So if you're having issues and your muscles are not working as well as what they used to, or they're no longer contracting, or they're they get spasms in them, which means essentially that the muscles tight up or they loosen up for no specific reason, you're not able to hold either your urine or your bowel movement safely in their locations. So, leaking is sometimes a problem, whether, you're laughing, you sometimes leak, or sometimes you don't even really know that you're going and you've had these accidents. It's not something that we like to, as any patient, it's not something that we're comfortable talking about. And it's also something, that you're sort of embarrassed or ashamed about. I do want you to really know, though, as anybody who's had a stroke, it is a very, very common issue for you to have. And to know that it's part of the stroke. It's nothing that you've done. It's another part of the issue that we will slowly start working and hopefully get you back to what you were able to do before. Another thing that is really important, specifically with your bowel and your bladder, is that it's also quite common for you to then have skin problems. So because we're having these issues in actually going to the bathroom, or we're not able to tell that we're needing to go to the bathroom or we're wet, whenever you have moisture in, places that are not moved around or they don't receive much air, it creates a really good environment for skin breakdown. So the tissues get really soft and actually really creates a great environment for bacteria to start to grow and to burrow. And eventually cause bigger issues such as your skin breakdown and blisters. And then even further from that too, because you're not able to always tell your sensation-wise, if you're lying in one position for an extended amount of time, any bony prominence, so wherever there's a bone that would be sticking out into a mattress, it can actually start to cause the tissues to die as a result of just clamping down and not getting enough blood supply in that area. So we always recommend that patients typically rotate from side to side every 2 hours, as long as people are confident and comfortable in their ability to be in that position and have access to notify or inform somebody that they need to move out of that position. And once again, 2 common places that you're looking about for your skin are going to be your hip bones, so really on the back, kind of just towards your lower back, the back of your shoulders, the very edges of your back to the scapula, the pointy pieces on the back, a lot of your vertebrae along your back, the back of the head as well, right? There's a nice big prominence over there as well. And then you're also looking at your shoulders towards the outside, your elbows, and then if you're lying on your side too, between your knees and your heels. So we just want to make sure that those areas, one, we're checking them daily. We don't want to see any redness. If you are seeing any redness or sort of, soft tissue, we definitely want you to start pushing just very gently on those tissues on the redness area. And what you're hoping to see is something called blanching. What that is if you're pushing on the area that's red, you want it to be able to sort of go white or change in color from white, and then quickly see how fast that goes back to being red or to the color it was. What you're looking for that is you're actually looking to see what your capillary refill time is. So is that area actually receiving blood? And if so, then obviously we want that, because the more blood flow you have to the area, the greater ability you're going to make sure that you're not getting any skin breakdown. And that's obviously what we're looking for. if you're not getting, or if it's taking a really long time for the capillaries to fill back up again, you definitely want to make sure that you're starting to really follow some of the pressure relieving mechanisms that we have. So we're taking some of the pressure off that area, and whether that is with pillows, and so you're sort of floating the heels, or you're turning onto your side more often, just to make sure you're sort of really working on rotating people side to side to get the area nice and sort of just the pressure off of the area. Okay. Some of the other problems that we're really likely to see, and this is largely dependent upon where the stroke is also some of the emotional changes. And a lot of times, this could be whether it's sort of unexpected crying or laughing that just sort of seems out of the blue. And it changes from, 1 minute you're crying for no real reason, and then in a split second you're laughing. A lot of these times you really have no control over the emotion. It's just that the part of your brain that would regulate emotion is not actually able to regulate it appropriately, and therefore, anything can really cause or set you off. It's also very, very common for you to feel depressed and sad, whether that is as a result of not being able to move the way you used to move, or not being able to express what you used to be able to say. Just sort of looking at an outcome perspective, that is a very common thing for you to feel. But sometimes, even if you are not really aware of what you are able to do or not do, just generally you are able to sometimes be depressed about things as well. And obviously we want to be able to seek some help if you do. It's also quite common for you to feel anxious or worried, or even just having a general lack of concern or interest in anything. A lot of these things, once again, too, it's just because your brain is not able to sort of regulate and understand what's going on. Some of the other things that we're also seeing is you're seeming to act without thinking or really thinking things through first. So you become pretty impulsive. A lot of the times, this is typically more so associated with people who've had right hemisphere strokes. They're not really able to see the logical types of things. And so this really places these patients at a huge risk for falling or anticipating or overestimating their abilities when they're really unable to move or do things on their own. Sometimes you also act or feel sad, sometimes saying things that aren't necessarily characteristics of who you are. So you're not really able to, that internal filter that you would normally have to stop you from saying things or acting out the way you normally would, that sort of inhibition is not really there anymore. And so sometimes your inside thoughts become your outside thoughts, and you're saying things that you normally wouldn't. And then one of the big issues that everybody has is really, will I be able to leave the hospital exactly the way I was before my stroke? And the one big thing to remember too is that every brain is different and every stroke is different. We can't really promise as medical professionals or tell you how much of your recovery you're going to have. But essentially, we can give you an estimate of what your prognosis is going to be, really based on some of your pre-stroke factors, such as your age, your health, and even some of your family history. So obviously, the younger you are, the more adaptable you are to being able to fix and change things. The healthier you are, whether that's your brain that's healthier or just your general body as well, the more likely you are to have some improvements. If you've got a whole bunch of other comorbidities or other diseases, your brain and your body is really struggling to dedicate as much of its healing properties to that one specific area, because it's working very hard to make sure that all the areas that have other diseases are working too, or are getting healed as well. And then obviously with your family history, if you have a greater family history of more people having strokes, then it is also just genetically, it puts you at a little bit of a disposition, making you more likely to have strokes in the future. We're also able to give you a little bit more of a prognosis on how quickly you were able to get to the hospital. So that's a huge factor, and it really is something that I want you to take home is, if you have those symptoms, whether it's for you and you're having an additional stroke, or it's for somebody else in your community, if they're having those symptoms of the FAST, right, face, arm, speech, and time, get to the hospital as soon as you possibly can, because the sooner you get to the hospital, the better your outcome is most likely to be. And the other thing to remember too is you may not leave the hospital exactly like you were before. Sometimes you will, other times you won't. But if you don't, you will at least have learned some modifications to be able to at least get you out and living a life closely resembling that of what you had before, but it may look just slightly different. Whether that means you're in a wheelchair, you use a walker or a cane, or sometimes it just takes you a little bit longer to be able to do those things. We want you to know that as a team of medical professionals, we still want you to be able to get up and get out and enjoy your life. The stroke is not the end of you. It is merely just something that has happened to you, and you are able to get out and still do things that are of interest to you. Just it might look a little bit differently. What else can impact how I recover? So there are some other factors, and many of them really revolve around not only just you as a person, but also just the environment that you have. So some of the physical factors really is the severity of the stroke, and your movement ability. So how much can you move initially after your stroke, and how quickly are you starting to recover that, which is obviously those physical factors. Some of the emotional factors are your mood, your motivation, and your persistence. Obviously, we know that this is a long journey ahead of you, and that the more that you're working with your therapist and the more positive mood that you have and the more dedication you are, the better your outcome is likely to be. We do know, obviously, that every day is a different day, and some days are really good and some days are bad. But the most important part is that you're coming back each day, starting new and really giving it everything you have to get you to that next level. And then lastly, we also have social factors. And this one is often sort of underrated within the hospital setting, but it plays a huge role really just in how you do recover. And that really is looking specifically at your support system, whether it is your family or your friends, whoever's in your network that is really there to help you, knowing that you have the support of your loved ones or even just friends in general, takes away some of the stress and the worry and the anxiety that you would otherwise have to be able to just do the things that you would normally do as part of your life, whether that's getting up or moving around. Knowing that you have somebody that you can rely on gives your brain some of the energy to be focusing on healing instead of worrying or stress. So really want to make sure we're looking into all those different factors. Also making sure we do remember that the fastest physiological recovery of the brain really is going to be happening within the first 3 to 6 months. But even after this amount of time, you still are able to see other recovery. But it's really dependent upon what you do, how you train, and how you're working your body and your brain. And then how do I get better? What can I do? Well, in traditional medicine, typically after you've had a stroke and you're stable, you're sent to an acute rehab setting. And within this setting, it is a relatively short but a very high intense hospital stay that focuses on teaching you the skills that are needed to be able to leave the hospital safely after a stroke. You're typically working with a team of doctors and therapists, whether that is physical therapists, occupational therapists, speech therapists, and recreational therapists. You're also working then with neuropsychologists, and the entire team together is there to help sort of look at each aspect of your life and get you at least back to the point where you're starting to move on to your next stage and being back into the community. You also have members such as caseworkers that are typically looking at your discharge planning and helping you follow up with your medical appointments. And then from there, we typically move you on towards outpatient therapy. And in outpatient therapy, you're primarily focusing on some of the higher level functional skills and also working your way towards vocational training. Sometimes it is only here that it's appropriate for you to start learning how to walk or even fine-tuning the coordination and movement patterns of your arm and hand. And it's not always necessarily expected that you would get this at the end of your acute hospital stay. So once you're stable, just to know that there is a continuum of care and that it's, like I said, it is a long journey, but you do have an entire team that's there to help you throughout the way. Some people, unfortunately, don't actually have that type of medical system that is set up in that way. So if you do have or if you're part of a healthcare system, that is really limited only to an acute care stay, meaning you've had a stroke, you've gone through the emergency department, and now you're sort of staying in the hospital. How do you sort of get to the point where you're able to get home safely? Typically, you'll be able to stay in that hospital until you're medically stable, meaning you're not going to have fluctuations in your blood pressure, or you're needing to have constant management of doctors and nurses helping you through the process of as your body starts to sort of acclimatize to this change in your new functional status. And typically, you're also going to stay at the hospital long enough for your family to complete some sort of training on how to help you, whether this is, learning the mechanisms of getting in and out of bed safely, learning how to sit up, or even standing. Then we're also working on making sure that you can get part of a home exercise program that is typically either given to the family members or to the patient. Most of the time, it's both people working together. And this really is looking into not only stretching and strengthening, but it's also really looking into the functional mobility components. So that's typically what a non-traditional healthcare system would look like. In some cases, though, patients don't really receive much care after their acute stay. Or even if they do, they don't really remember all of the information that was taught to them. A really great thing is, Health4TheWorld actually has developed an app that not only in the various sections, it has an exercise section in which it shows you with video demonstrations, how to move a patient from each of these positions, whether it's, how to get them from sitting to lying down or from lying down to sitting back up. And that shows you, if you're fairly low level and you have just sort of forgotten where your hands are supposed to be and how you're supposed to help somebody. It also takes you through various exercises, which really can cover each component that was taught with or should have been taught as part of the home exercise program. And so that really does give you exercises on stretching, strengthening, and functional mobility. A lot of these exercises are actually taught to you in a seated position, but you are able to modify them and make sure that you're able to do them in a lying down position. Either way, it's really just making sure that you as a patient and as a caregiver feel that you're supported and you have everything that you need to be able to get you to continue to do the exercises that we're looking for. Because the more exercise you do, the better you're going to be. All right, so once I leave the hospital, am I really finished with therapy? So just to reiterate, every person and every brain is different. Recovery after a stroke can take a long time, and most of the time it can be frustrating. Continue with your therapies, whatever it may be, whether it's inpatient or outpatient, or if you're even using the app. Just continue to do whatever you can to keep your body moving and healthy. The more you do, the better you are, and each step you are to being closer to being independent. Complete recovery may not always be the outcome, but part of the rehab process is to really learn how to continue living a healthy and fulfilling life even after you've had a stroke. So the most important thing to remember is you may have had a stroke. It has changed how you do things, but it hasn't changed you. You still have the same goals, ambitions, and desires as what you had before. You are able to do them, but how you do them is going to be slightly different than what you did before. Just continue to be a part of that exercise and keep on doing it. All right.